Good morning to the second year students. This is also a pathology topic, that is a infective endocarditis. Infection to the endocarditis. So we will see how the infective endocarditis can be occurring. Infective endocarditis is an infection of the endocardium by any microbial agents. So this is usually involve valvular endocardium and produces the lesions. So it involves the endocardium and the inner part of the heart. So endocardium, the infection to the endocardium by microbial agents. So that is nothing but infective endocarditis, something related to the infection to the endocardium by microorganisms. So this usually involves valvular endocardium and produces the lesion. What is the lesion called? Vegetation. So it produces the lesion called vegetation. These vegetations, what these vegetations composed of? Platelets, fibrins, micro colonies of the microorganisms, and micro colonies and chinnavi more number of organisms, colonies, and scanty inflammatory cells. So some of the scanty inflammatory cells. So usually it is an infection of the endocardium. It involves the valvular endocardium and produces lesion types called vegetation. These vegetations, what they compose? Platelets, fibrins, microcolonies of the microorganisms, and scanty inflammatory cells. So it is classified according to the clinical course as acute and subacute endocarditis. So it is classified as acute and subacute. So acute means sudden, subacute or subacute endocarditis. So etiology and pathogenesis: causative organisms. More than 90% of infective endocarditis is caused by streptococcal and staphylococcal organisms. So this streptococcal, it may infect healthy or deformed walls. So major organism is because in intravenous drug abuses, Staphylococcus aureus infection, so intravenous drug abuses can see, and Streptococcus viridans, portal of entry is through the oral route. And next is a coagulase negative streptococci. So coagulase negative streptococcus, this bacteria commensal in the oral cavity. This is also actually will be in the oral cavity. So this Haemophilus, Lactobacillus, Cardiobacterium, and Kignella, this all will enter through the respiratory tract and to the respiratory tract intro. And other agents includes gram-negative bacillus and fungi. So culture negative endocarditis, 50% of the cases can be seen with infective endocarditis. No organisms can be isolated from the culture of the blood. So these are all the organisms: streptococcal, staphylococcus, coagulase negative streptococcus, and then other agents, gram negative bacilli and fungi, culture negative endocarditis. So these are predisposing factors. Conditions with bacteremia. So this bacteremia develop because of dental or surgical procedures. Because of any dental or surgical procedure or urinary catheterization may lead to the endocarditis infective. Underlying heart diseases. So involves normal or damaged heart valves. Infected endocarditis on previous normal valves, usually with high valence of organisms. Damaged heart valve may due to because of, why it may be because congenital heart disease or chronic heart diseases, rheumatic heart disease at that time. Impaired host defense mechanisms. In case of impaired host defense mechanism, diabetes, leukemia, lymphomas, these are all the causes. Gross appearance. So this gross appearance means how it looks. The presence of vegetations. So vegetations and platelets, so fibrins, scanty inflammatory cells. So it can be seen. So and then microorganisms. Some of that most commonly found on the aortic and mitral walls. Mostly aortic and mitral walls దగ్గర కనిపిస్తుంది. These vegetations are how it will be friable and ఊడిపోయారు and bulky. It will be friable and bulky, may be single or multiple. Vegetations may be single. Aortic, mitral, friable and bulky. The complications. So how the complications? Definitely infective endocarditis complications are cardiac complications, extracardiac complication, immunological phenomena. So these cardiac complications may spread locally from valve and produces an abscess which known as ring abscess. So it produces a ring abscess and perforation, rupturing of the involved leaflets, myocardial abscess, suppurative pericarditis, valvular dysfunction. So all these things will be happening. Whenever this abscess occurs, definitely there may be some sorts of pus formation. So it may perforate it into all other things, and there will be myocardial abscess. Then some pericarditis can be seen. This can be spread. Valvular dysfunction. Obviously, there will be valvular dysfunction and stenosis formation. Extra cardiac means this septic emboli. The vegetation are likely to be break and detach, cause embolism. And that will be febrile. No, this can be detached and causes a look like emboli formation. And septic, it may spread to the spleen, brain, kidneys also. Immunological phenomena. In case of fragile, actually vegetations are fragile, so that can be detached and transferred. Immunological phenomena. Focal segmental glomerular nephritis. So it can be seen and ossular nodules, nodes. So how these nodes look? Small, tender. It will be very small, tender, subcutaneous nodules in the pulp of the digitis and persist for hours to several days. And splinter hemorrhage in the nails and raw spots and retinal hemorrhages in the eyes. So retinal hemorrhages also can be seen. Cardiac complications, extracardiac immunological phenomena. So this is regarding the infective endocarditis. Infective endocarditis is an endocarditis which is pertaining to the endocardium caused by the many microorganisms. It may cause the vegetations. These vegetations are very composed of proteins, these microorganisms, platelets, not only that, and scanty inflammatory cells. And these vegetations are friable, bulky in appearance. It may be multiple or single. It may have a complications like cardiac complications, extracardiac complications, and immunological phenomena. So this is regarding the endocarditis. Thank you.